Assalamu alaikum. Today I will talk about the surgical intervention for GERD, for gastroesophageal reflux disease. Certain cases they will require surgical intervention. GERD means the lower esophageal sphincter is little bit weak, then we have hyperacidity coming into the esophagus. Certain cases where they have something called hiatus hernia, where the stomach is actually up into the chest, into the esophagus, they have too much symptom, usually they will require surgery. The assessment of the hiatus hernia. During endoscopy, sometimes it's exaggerated. Usually it's size less than 5 centimeters. We call it small hiatus hernia. Most of these patients do not require surgery, only medical therapy. If the hernia is bigger than 5 centimeters, and the symptom usually vomiting, not only reflux. When they kneel down, when they do any certain movement, they have too much vomiting. They will require a surgical intervention. Before that, they will require a barium X-ray to better evaluate the hernia. If it is more than 5 centimeters with severe symptoms, including vomiting, they will require surgical intervention to repair the hernia as well as the lower esophageal sphincter. The second reason to undergo the surgery is for patients who cannot afford the medicine, especially abroad. The medicine long term will be more expensive than the surgery. So some patients will undergo the surgery rather than taking medications. There is a new technique called stretta procedure, which is fixing the lower esophageal sphincter during endoscopy. It's been done in many centers in Kuwait. Some people start doing it. The experience with it is very limited. The results success rate very limited, and we don't recommend it for patients usually. Those who have mild symptoms, they will benefit from the surgery. Those with severe symptoms, they should not do it. So very rarely patients undergo these surgical interventions, but in particular situation when they have a hiatus hernia, it should be evaluated, especially with symptoms of vomiting. Otherwise, it's only medical therapy for GERD. Thank you and goodbye.